I ultimately chose to focus on immunology. So I take care of kids with immunodeficiencies, where their immune system isn't able to fight off infections. So if people have an inherited defect in their genetic structure that makes them more susceptible to infections. I generally try to screen them for, like, do you have an immune deficiency? So I really try to hone in on, if there's a problem, which is the likely area of the immune system that would be having a problem, and then I focus any testing we do on that. So that's my overall goal, is to figure out, to kind of orient us to what we're dealing with. It depends on the age. If it's a tiny baby, then it's more discussion with the parents. As the kids get older and enter their teenage years and things, it's much more of a conversation directed to them, and the parent is someone who's there and who I'm very polite to, but the patient is always the child. And that becomes more apparent as we get older. But I think it's a therapeutic alliance that I'm trying to build with both the patient, child, and also the parent. So it's almost never a one and done. So if we do any kind of testing, I'll almost always want my patients to come back either virtually or in person to discuss the testing results. Normally at least 2 visits. Often though, if we find something that's of concern, it'll be a very regular follow-up. Because I want to keep a close eye. There's a lot of other things that can develop over time in association with an immune deficiency besides infections. And so there's things we need to monitor. So I always like to check in with my patients, so generally at least once a year. You get to know them and the family, and that's a very rewarding thing. I used to be a general pediatrician years ago, and it kind of reminds me of that, having that longitudinal relationship, and I do enjoy that a lot. I'm here for you. I'm probably one of the very few people in this area that focuses on this. So, and at the Cleveland Clinic for Pediatrics, this is all I do. So if your child has an immune deficiency, I'm very happy to see you and help out with the lab workup, and we'll take care of things.